All right, today we're going to dive into a pretty wild corner of medicine. We're going to see how something as seemingly simple as a problem in your mouth can escalate into a full-blown, life-threatening emergency. We'll be looking at two really serious conditions that often start with something you might ignore, like a toothache. So let's get right into it. Okay, so our story begins with a medical mystery. Imagine a patient rushes into the emergency room. They have this swelling under their chin and across their neck that's not just big. It's growing incredibly fast, and it's super tense. It's a seriously dramatic and dangerous situation. And just take a look at this. You can see exactly how severe this swelling is. It's not just under the chin, it's spreading down into the neck. This isn't some minor inflammation, folks. This is an aggressive, runaway infection that is getting critical by the minute. So, for any doctor seeing this, the immediate question is, what on earth is going on here? What kind of process could cause such a fast and, frankly, frightening reaction? It's a total race against time to figure it out and do something before it's too late. Well, here's our answer. This condition has a name, Ludwig's angina. Now, what that means is it's a rapidly spreading cellulitis. That's a type of bacterial infection. But this one is happening deep inside the tissues under your tongue, taking over the entire floor of your mouth. And that word bilateral is absolutely key. It means it's happening on both sides at once. So, to really get why Ludwig's angina is so incredibly dangerous, we got to do a quick anatomy lesson. Because the real threat isn't the swelling you can see on the outside. It's all about what's happening on the inside, in a very specific and very vulnerable part of your body. Now, this diagram is fantastic because it basically lays out the battlefield for this infection. What you're looking at is a cross-section of the lower jaw. You can see the tongue at the top, and right underneath it, these two crucial areas. The sublingual space, which is right under the tongue, and the submandibular space, which is a little lower down. This right here, this is the danger zone. So here's how it usually goes down. The infection kicks off in that lower submandibular space. But there's no real barrier to stop it, so it quickly climbs right up into the sublingual space. And it doesn't just stay on one side, no. It crosses right over the middle and just engulfs the entire floor of the mouth. And this right here is the central crisis. As these spaces get filled with infection and start to swell up, they've got nowhere to go but up, so they shove the tongue upwards and, most critically, backwards. This action physically starts to close off the back of the throat, blocking the airway. And that is what makes Ludwig's angina a true life-or-death medical emergency. Okay, so now we know where this happens and why it's so incredibly dangerous. The next logical question is, how does this even start? Well, the answer is going to surprise you with how common it is. Believe it or not, this terrifying condition most often starts with a simple, infected tooth. Specifically, we're talking about an abscess at the root of one of the lower molars. You see, the tips of these roots sit right at the level of that submandibular space, basically providing a superhighway for bacteria to get from the mouth into those deep tissues. And the signs of this are exactly what you'd expect from such a deep, nasty infection. Patients find it incredibly hard to swallow. They often can't even open their mouths all the way, a condition we call trismus, or lockjaw. The swelling itself has this really distinct feeling. Doctors describe it as woody hard to the touch. And in the most severe cases, that swelling can go all the way down to the larynx, the voice box itself. Treating this as an absolute sprint against the clock, and the protocol is crystal clear. The number one top priority before anything else is to secure the patient's airway. Once you know they can breathe, it's a full-on attack. Powerful IV antibiotics to kill the bacteria, an urgent trip to surgery to drain all that infected material, and finally getting rid of the source of the whole mess, the infected tooth. Now, I want to clarify something really important. The word angina might make you immediately think of heart pain, right? But in this context, it's an older medical term that just refers to a sense of strangling or choking. And Ludwig's angina isn't the only throat infection that uses this name. So let's look at another one, just to make sure we don't get them confused. So this is Vincent's angina, which also goes by the name trench mouth. And it's a completely different beast. Unlike Ludwig's, which is a deep tissue infection, this one is on the surface. It causes these painful ulcers on the tonsils, the throat, and the gums, and they get covered by this very characteristic grayish-black film. This slide just makes the difference perfectly clear. Look at this. Ludwig's is a deep infection, down in the floor of your mouth, usually from a tooth, and the main danger is that you can't breathe. Vincent's is a surface ulcer on your tonsils and gums, caused by a totally different mix of bacteria, and while it's super painful, it doesn't typically threaten your airway like Ludwig's does. So the takeaway is crucial.
Two very different problems that just happen to share a name.
So after going through these two pretty intense conditions, what's the big picture here? What's the main idea we should all walk away with? Well, it really all boils down to a very simple but incredibly powerful concept.
Let's just recap the most important things to remember. First, Ludwig's angina isn't just serious, it's a true, life-threatening emergency that can block your airway. Second, and this is the wild part, this terrifying condition almost always starts from a simple tooth infection. This means, and this is for you, any significant swelling in the floor of your mouth or your neck is a major red flag. Don't ignore it. And all of that brings us to the final, crucial point. Taking care of your teeth isn't just about having a nice smile. It is an absolutely critical part of your overall health.